traumatic for mother and child. So if babies are left under normal, natural species, normal conditions, the baby decides when they want to be born. And babies vary by about 55 days how long they want to stay in the womb. 55 days, right? So, well, no, but we have medicalized birth. And so the doctor decides, oh, this is the due date based on whatever. And then I'm going to induce your labor because this is the due date, whatever it is. And so you're pulling babies out. Most babies now are born prematurely because of that, right? Based on some due date. And so when you ignore the baby's signals, the baby's already getting traumatized by not being able to get their full capacities for living outside of the womb. You have to have your lungs develop properly. So there's a lot of lung issues. And then the birth practices are just brutal because we've moved into profit-oriented childbirth. And a lot of doctors want to get that baby out in 26 hours. A firstborn baby is going to take maybe days for that mother who's not used to giving birth and everything. They need to do that dance, interpersonal dance of the baby comes out a little bit and then goes back, a little bit more and then goes back. And that's gets mom and baby used to, the rhythm of being together. And so when you use drugs to pull the baby out, you're now pouring in fake oxytocin, which diminishes the mother's oxytocin. So mom's hormones are intended to go in these waves of energizing and then calming and keeping pain from happening too severely. But medicalized birth keeps mom in a kind of tethered to the monitors and all these things, and she can't move, so pain increases because she can't move around like you normally would, and so she wants painkiller. Oxytocin, the fake oxytocin, is flooding her body, so it messes up all the hormones, and the child's too. The child is taking all these drugs into the body, and the fetus cannot process them, so they're going to be drugged when they come out. They can't breastfeed. They cry because they feel so distressed, and then they sleep. And so our hospital birth babies are essentially 2 months behind a naturalistic birth baby. They can't sit up. A natural birth baby can sit up and look at you and smile, and can watch mom move around the room. Our babies can't, hospital birth babies can't do all these things.